All right, guys. This is Dr. Bailey with Dr. Bailey's Evolved Health and Wellness. Got another good little Medical Monday. Today, kind of an interesting topic. It's not a huge topic, so this shouldn't be an overly long video, but it's definitely something that's asked quite a bit. It's a topic we come across a lot. Pregnancy and cannabis. So we'll give some folks just a few seconds here to get on and tune in. Give it a like, give it a share, get it out to some folks. The more people to see it, the better. It's purely just an educational talk, and I like to try to do these as much as possible for questions that folks have. Hey, Charles, how are you doing, sir? Um, hey, Chris, just trying to make sure that it's something that people can use and it's information that people are interested in, people can use. Got We're 2 weeks out from our fight in Oklahoma City. Super excited about that. Just had our training this weekend with the National Guard. That went well. We got some great young soldiers coming up and had some pretty good time out at Camp Gruber. Let's see here. Hello, Miss K. Hope you're doing well. Again, today's topic is cannabis and pregnancy. You know, it's something that there is not a lot of research on. When I say there's not a lot of research, there's really not a lot of research, and most of the research I read was negative. I'm not gonna lie. There's a lot to be done in this area because we know that CBD, CBN, CBG. We know a lot of these compounds do a great job with decreasing inflammation, helping with cognitive abilities as we grow older. But how does it affect the developing brain? That's something that is a big push right now because of the fact that we have all of our medical programs. We got 30 some states right now with medical, if not medical and recreational programs. So cannabis use and pregnancy is going up at a exponential rate. Um, what we know is that roughly 70% of all THC consumed by mother is past the fetus. Now, it's stored in fat tissue. Now, in a developing fetus, the brain is predominantly fatty tissue. That's where the concern comes from. I won't even say naysayers, but folks that are not all that big believers in cannabis. Had a talk about a week and a half ago with one of the medical boards in this area, and they kind of were not happy about the idea of writing for pregnant patients as far as writing recommendations or certifications, depending on the state. Um, I'm a big proponent of using natural when possible. The other issue is this: medications as a whole are very difficult to dose and to dose it correctly in a pregnant patient. There's a ton of side effect profiles that we know about. And the discussion I had with that medical board individual was, well, they were concerned about writing it for pain because a lot of women develop lumbar pain, low back pain with pregnancy, and it's just from carrying fetus. Well, you also have to think about uh, morning sickness, postpartum depression, a lot of issues that can be treated with cannabis products, but also must be treated cautiously. Now, until we learn more about this, I always encourage more of an indica dominant variety. Trying to make sure that we decreases our THC exposure to fetus as much as possible, just until we know more. Now, is that saying don't use? No, it's not saying don't use. Is that saying that it's bad? No, but I'm not saying that it's great because we just don't know. And I would always err on the side of caution when it comes to that. And anybody that knows me has been following this page for a long time. I mean, I fight for cannabis, freedom and access all the time. Talk to other physicians, other boards, I mean, other specialties, modalities, it doesn't matter. But on the flip side of it, I understand where our weaknesses are, and our weaknesses are in research, and weaknesses are, what long-term effects can we expect? Now, even Forbes magazine had an article out that showed, hey, we don't really see any long-term effects cognitively in patients that were born to parents that used cannabis. And I agree wholeheartedly. I haven't, at least in our patient population, we haven't had any issues reported. I have several OB-GYN physicians here in the Tulsa area that send their patients over for recommendations because of the fact that they can get significant improvement there with their nausea for morning sickness and maintaining weight, because that's a big deal in a pregnancy, is maintaining the appropriate amounts and levels of weight. Let's see here. John Cummings, yes, sir. We do need to meet, which does remind me. It's hard to jump off topic for a second, but as I said earlier, we got a fight coming up next week. We do. I do want to thank JKJ Processing and Green Country Bud for coming on board with us and helping with the sponsorship for the fight. It's going to directly go to a veteran organization here in the Oklahoma area. We are going to be working with Kyle Early's program out of Oklahoma City. We will be presenting them with a donation at the fights. So tune into the fights. If you're able to come, check that out. We or at least, from my standpoint, big believer in helping out our veterans as much as possible, whether it's cannabis related, medical related services outside of the medical field. Let's see here if there's anybody I'm missing. Now, what we need to look at is which of the endocannabinoids cause head high, which of the endocannabinoids cause the psychoactive, Delta 9, THC Delta 9 is the one we watch for the most. Delta 8 to not near the same degree. So what we want to try to do is we want to try to look at and isolate, removing those endocannabinoids as much as possible whenever we're dealing with fetus. So when we're dealing with a baby or a pregnant mother. And that's only, again, until we know more. Now, I'm all for using cannabis for, again, nausea, postpartum depression, lower back pain. The topicals are a huge option as well. That's something I think a lot of people sleep on and miss, is that. Too many times when I'm doing my renewal recommendations, especially right now in Oklahoma, I have folks not getting the benefit that they're wanting or expecting. And not a lot, but there are some. And when we sit and talk, well, what are you using? How are you using? When are you using? Those types of things. We're getting a lot of redundancy. And so a lot of this, again, is going to fall on the bud tenders of, hey, how can we help these patients? Well, let's ask them, hey, are you getting benefit from what you've used previously? Because if you're not getting any benefit, then we're doing something wrong. We need to go to a different angle, a different path, a different mode of intake, something along those lines. Samantha Sanchez, what week would you suggest stopping marijuana use in pregnancy? I prefer, just like with medications, we really limit our medication use during the first trimester. That's when you have your greatest development stages going on there. I would try to not use during the first trimester if possible. And if that's across the board, that's any type of intake of pharmaceuticals, of cannabis, of anything that may cause any type of derangement there. And if you're going to use a cannabis product, make sure it's an indica dominant variety. Again, we know that CBG helps with inflammation. It's a potent antioxidant. I really think we're going to see that we have some cognitive improvements in those groups long term, but I think it's going to be something that we're going to have to kind of play with and see. There's a reason that it helps with the spectrum disorders in young ones because of the way it works in the nervous system. So I'm really curious to see that way. That's the easiest way to get American. Mr. Bledsoe, if you just message the Evolve page, I'll get you set up on how to get a card pin on the state you live on. Hey, Justin, how are you doing, sir? So Samantha, to answer your question, what week would I suggest stopping marijuana use in pregnancy? Just the first trimester. After that, I would think you're okay. Now, here is something else that you have to contend with and be prepared for. DHS. Now, legally, can they come and take your baby? No, they can't. And if someone has had that happen, first off, I've heard stories of friends of friends of friends. I've only come across 2 cases in 2 years. Do I think that there's some there? There may be, but it will hold up in court. No. Now, what that may do is they may show up at your house, and they may do walkthroughs and make sure that it's a good, clean, safe environment for baby. That is to be something that could happen very, very easily. But outside of that, no, there shouldn't be legal ramifications because of the fact that you have your license. Now, obviously, that does not cover any other substances that may test positive. Miss Samantha, yes, depends on the age and the state. If it's Oklahoma, needs two physicians to get a recommendation. Under the age of 18, Arkansas, it depends on the age. I can write him in Arkansas, but I will tell you the medical board frowns on certain ages, usually below about the age of 13. They're very, very difficult to get a recommendation past them for that. Let's see here. Apologize, guys. We've got a couple different shares and different pages. Boom, boom. All right. Now, so kind of the high points that we've covered. And like I said, this isn't a very in depth, just from the stance that I want to tread lightly with this topic because I know it will. There are some people outside the cannabis industry that will get upset and bothered by it. And if anybody knows me, knows that I don't care too awful much about what other people think, as long as it's factual and straightforward information, at least factual to the degree that we know. Yeah, then I'm definitely going to be all for it. So try to avoid any use in the first trimester if possible. If you're going to use during pregnancy, try to avoid THC high varieties and strains. So your strong sativa is definitely a no go. Um, Almost everything I looked at good for marijuana, against marijuana, was against inhalation. And I think that had a lot to do with peaks of THC in bloodstream and then subsequent delivery to the fetus or to the baby. What we know with the edibles, especially when taken with food, it decreases your peaks. So you don't get these big spikes of concentration. You get a steady state for longer periods of time. I think most people are aware of that. Let's see here. Any other big questions? I think I got most everybody's. Boom. This is a topic that I'm probably going to revisit a couple different times, especially as we get things going, um, and we get more and more research on board. I know LSU is doing some research down in Louisiana. There's some research going on in Arizona. I believe there's some in Washington State as well. So as we learn more, this is kind of the new scientific front in the medical community. And anybody that argues that is blind or foolish. There's so much to determine here. I mean, when you have 61 endocannabinoids, trying to figure out which one of these is going to be helpful in certain scenarios, or when you combine that with the entourage effect and terpene profiles as well, it's going to be a big deal. And especially when you involve fetal development. I think that's a huge topic. You start getting into all the political and religious sides of that. So I think that there's going to be some huge research going along in that area. All right, everybody. If there's anything further you'd like to know, any big questions that you have, another topic that you want covered, shoot me a message over to the Evolve page or comment on one of the events for the Medical Mondays and see if it's not a topic that we can help you out with. I'm going to continue to expand on this one as we gain more and more knowledge and we gain more research. It's going to be an ever growing area, I strongly believe. Again, we got the fight in 2 weeks. Week from this coming Saturday, Oklahoma City at the Oklahoma City Farmers Market. Tickets, if you just Google Stubwire and then Oklahoma City Farmers Market, it pops up, Rage in the Cage. We've got 4 tickets, general admission tickets we're going to give away on next Monday's Medical Monday for liking and sharing out videos. And again, if you guys ever need anything, if you message the Evolve page directly, you're going to get me about 90% of the time. Nicole Condry, no, you do not need medical records. I do ask that you know your medications or have a good, accurate medication list available for your appointment. While I'm on the appointments, this is off topic from Medical Monday, but for Zoom or any other conference, guys, play with this ahead of time because it's super, super busy with renewals for both states right now. And what I'm running into is folks that do not know how to use Zoom or do not know how. If you play with it ahead of time, have an understanding of how it works, makes everything go so much smoother. Make sure you don't use PO boxes whenever you're trying to set up your appointments, whether in Oklahoma, especially Arkansas, you guys are allowed to use PO boxes. That will help facilitate the appointments in a big way. All right, man. Appreciate you, Travis. All right, you guys. I hope everybody has a great rest of your Monday. We're gonna head over to the gym, get some training in. We'll have some new and exciting things popping up with that as well in the near future. So watch out for that. Hope you guys have a great week.